Hello everyone. You know how we say first impression matters a lot? The same goes for your house job, your medical internship here. It can leave either a very pleasant taste in your mouth or a very bitter taste. And this goes on to affect one's passion or decision to even go ahead in the path of clinical medicine. So it's important that you put a lot of factors into consideration before selecting where you want to do your internship. Now, some of these factors will be negotiable, some will be non-negotiable, depending on what you rate as highly important for yourself as an individual. I'm going to highlight all of these for you, so you should be aware the things you should consider before picking the location for your internship. It's important you consider how available power supply is. For me, this was a non-negotiable. I needed somewhere that had relatively stable power supply as much as 24 hours if possible. I had options that were available that would say about 8 hours of power supply, and I knew that would not be sufficient for me, just generally, and also for the things that I had lined up to do for this year in particular. You want to come into a home, a place where you can charge your phone at leisure, you can use your microwave, you're sure that if you're putting things in the refrigerator, they will not go bad. So power supply is something that you should consider, because some people have quarters, doctor's quarters, that is disconnected from the main power supply of the teaching hospital. So you want to ask about power supply before you pick that center for your internship training. You should find out about the accommodation arrangement. I'm sure you can see my room. It's pretty decent. It's okay. It's perfect for me. I have a bathroom to myself. I have my room to myself. Pretty spacious. Now, this is a flat arrangement. We share a kitchen. There's a refrigerator provided. We have cabinets, and you can store your foodstuff and whatever in that place. But basically, find out, because also I knew that I had relatively stayed in pairs all through my medical school training, and house job was a year that I would have a lot to do rather, and I did not want to inconvenience anybody. I also wouldn't want myself to be inconvenienced. So staying alone was a huge priority for me. It was non-negotiable, and I'm really happy it turned out that way. Now, different centers would have different degree of furnishing, so to say. In some places, rooms come with air conditioners, microwave, refrigerators, as the case may be. There are some rooms like that where I am. I'm just using that as an example. But if you know that those are things that you want to consider, so you will not have to spend so much sorting yourself out within that particular year, it's also something you should ask questions about. The work culture. This is super important. How toxic is the environment? Now, toxicity doesn't translate into workload. Toxicity means the attitude of seniors, the attitude of nurses, the attitude of the persons you'll be working with. The least that you would want to encounter daily is toxic people, toxic seniors. We hear people giving extra calls, extensions, just at the slightest mistake or mishap, whatever the case. While you do your best to make sure that your job is done and done well, it will be sad if you put in everything and then you still have people who are just victimizing you because they are inherently wicked persons. They do exist. Now, the challenge is some of these toxicities are systemic, some are individualistic. It's easier to deal with the individualistic ones because they come on like a one-on-one basis, but the ones that are systemic, where the whole system, everyone is immersed into that atmosphere that has been set, I mean, it can be hell. So you want to make findings. How do seniors relate with younger colleagues in that particular environment, so you're sure you know what you're getting into? I've heard stories of how things happen in some sections of this country, sending interns out to go and pick children up from school, sending them on errands, on motorcycles and all of that. You know, there are crazy things, and they don't come up as suggestions. It's like must do, go and do this. And because you don't want an extension, you don't want whatever, you just oblige. It's not something I'll be able to put up with. So it's just best that I do not even get into that space, because it means that I'm going to have issues with whoever is there. Because at some point, people have to stand up for their right and say, no, this is wrong, I won't do that. So if you're willing to go that path, fine. But if you want somewhere that is not toxic, where doctors are respected, even the younger doctors are given their due respect, please ask questions and ask people that will be sincere. No, don't ask persons that just because they want you to come to their center to relieve them of the present workload, they will tell you everything is pitch perfect. No. So make sure you ask that question: how toxic is the work environment? That will go a long way into helping your mental health for that 1 year of your internship. So you want to also ask about call duties. Now, there are different ways call duties run. We can either have team calls or individual calls. Now, individual calls have an advantage because it tends to be fewer. Yeah. So, for instance, the posting I'm currently doing now, I would likely be on call, let's say once in 2 weeks. Now, there are other places in the same training center, some other departments where you might be on calls alternate days or even daily if you are the only house officer in that unit. So currently, excessive calls is not something I'm having to deal with because we have the population, we have the numbers. However, if we're doing team calls like we did in obstetrics and gynecology, sometimes I'm on call twice a week, sometimes once in a week. And then pediatrics, usually maybe once a week. I'm giving examples. I'm not trying to, because I'm just giving these examples based on my direct experience here, so that you have something tangible to hold on to. This is not an advertisement, for my center whatsoever. But you might find out in some other places where people are on call every day, either because they currently don't have enough manpower or just because that's how those departments have designed the program to work. So you want to ask about frequency of call duties. Are people allowed to go on maybe 2-3 hours breaks, rest when they're on call? There are these little allowances that make the work a lot more healthy for you. So find out about the call duties, the frequency, how hectic they are, and pre and post call, what allowances are made for you to sort of have rest and prepare yourself for the next day. The standard of living. It's no news that cost of living is rising in Nigeria. So you need somewhere that is affordable. Transportation wise, the cost of feeding, the quality, the quantity of food, affordability of the basic necessities you would need to survive during your house job here. Is there a market close by? There are some of these questions that you want to ask yourself, because with the rising cost of things, sometimes you might find it challenging to save if you're spending all of your income on just the things that you need to survive. So you need to ask, what's the standard of living in that environment? If you're going to be staying out of the hospital, what's the cost of accommodation like? It would not make sense to be paying something as much as 600, 700,000 naira for accommodation. So you want to make all of these findings. If you decide that you want to settle in that environment immediately after house job, these are also some of the things that you should be thinking of. So the general standard of living, the cost of living, on average, what do people tend to spend in a month to survive in that particular location? It's something that you should consider. Proximity for international purposes. The JAPA wave is on. If you're currently considering leaving the country, you should find yourself in a place where you can write your international exams, whether IELTS, if you're going the PLAB way, the USMLE way, the way to Australia, Canada, whatever exams that you intend to write, you need to make these findings now. Even if the location is not there, you have access to visa centers, you have access to places where you can just walk in and do what you need to do without having to either board the bus or get a flight ticket and you're having to go long distances. Now again, remember, some of these things are non-negotiable, some are negotiable, just depending on what you prefer. So put that into consideration. If you need one or two things to make your way out of the country, you have to factor it into the location that you're deciding to do your housemanship. Now, the role of doctors. In some centers in this country, it's the doctors, the health officers that serve IV medications. Worldwide, it's known that it's the responsibility of nurses. They check vitals, ensure patients are stable in the ward. They carry out the instruction of doctors, not because they are inferior to doctors. No, everyone just has a prescribed role and responsibility. As a doctor, your primary work is to see a patient, make an assessment, draft a management plan, and then other persons carry out at least some part of the management plan. You don't have to be the one to prescribe your medication and have to serve. So let me give you a typical example. So you're on call in a ward, let's say there are 40 patients. If you're the doctor on call in that ward, what it means is that you may have 3 nurses attached to that ward. And nurses run shifts, 8 a.m. to 2 p.m., 2 p.m. to 8 p.m., and 8 p.m. to 8 a.m., 3 shifts. So they are quite more in number than us in some centers. So you will come to that ward and serve medications to all 40 patients. Meanwhile, you have 3 persons who are sitting down there, probably just checking vitals or doing a few procedures for those who have procedures to be done. It's not right, it's wrong. It's draining, to say the least. I've heard of the story of someone who, when he's getting to the end of the ward, by the time he's about to return back, the next time to serve medications is on. On the reverse, the typical scenario for a doctor on call in a ward where you're not the one serving medications is you come into the ward, you go to the call room, you lie down. If there's any issue, an emergency, whatever problem, you need to do a procedure, you get a knock on the door and you're invited, doctor on call, please come and see this patient. There is a complaint for this or this, and you do what needs to be done. These are 2 different scenarios entirely. If you want to do things outside a houseboy or a housegirl work during your housemanship, you should. This was a non-negotiable for me, frankly speaking. So you should consider that while you're deciding where you want to do your internship. It's very important. Now, the amount of pay. Currently in Nigeria, this is standardized to a large extent for the federal government centers. However, there are some exceptions. There are some centers in Lagos that even pay higher than what the federal government pays. There are some centers in some states that pay less. So you decide what you want to go for, and if you have the means to go for what pays higher, why not? Otherwise, you put every factor into consideration and decide, okay, this is a pay I would relatively be okay with. I can cope with this, spend a certain amount and also get to save. So put the amount of pay into your consideration while you decide where you want to do your house. The workload. Now, workload is determined by, let's say, two factors primarily. One of them will be the number of health care facilities you have in that environment. In some states, for instance, you would have, let's say, 2 tertiary health centers, like 4 or 5 general hospitals that are functional, and then a few primary healthcare centers. In some states, there's just 1 teaching hospital and private hospitals. The workload will be very, very different, because what happens is that the number of patients in that state will be distributed across all the facilities available, the top-notch facilities available in that state. So if you're going somewhere where it's like the main center, the only center, you're going to see premium shake. You know, you're a medical person, so when we say shake, you understand what we mean by premium shake. So please and please, if you know you don't want to sacrifice yourself, just immerse yourself into that kind of environment, you should consider how many facilities do they have in that state or that city where you're going to do your internship. On the other hand, you also have to consider the carrying capacity for interns. So some centers have, like, let's say 110 interns allotted to them, some have 50, some have 30 something. Trust me, the work will be different. The work will be different. The more hands you have, the more distributed the work is, the less frequency of calls you'll get to do and all that. So it's important that you put these factors into consideration where you're deciding where you want to do your house. Now, the hands-on clinical experience. To a large extent, this is determined by how passionate you are or how interested you are. The only places that will be exceptions will be in centers that train interns and there are no residents in training, and also perhaps they don't train medical students. So it means to just be between the consultants, the medical officers and the house officers. So you get more practical hands-on. However, in the state facilities, in federal facilities, it all boils down to interest. Yes, you may have 1 or 2 seniors who would go the extra mile to tell you, even if maybe you're shy or you seem to lack confidence, come and do this, come and try. Otherwise, it's just based on interest. You're watching, you've seen them do something the first time, second time. It's left for you next time to say, I want to try. The procedures will be there for you to do. It's now your interest that actually determines that. So when people are talking of Handson Experience is not available in this center, it's not available in that center, most times it's not true. You want to even assist in a surgery, you're free. You want to try your hands in the actual surgery, I don't think anyone will stop you. It just depends on how interested you are. So get your interest game up, and Handson Experience definitely will not be a skill for you. I think it's important I mention at this point that you should know what you're supposed to know, because some people seem to be overzealous, and then when I hear them talk, they are missing out on the point. Internship is not residential training, it's different. So you won't have the goal of a senior registrar in the department. Let's say you want to be able to do a major surgery. It's not like it's bad, but is that really what you're after during your internship? There are some basic skills that you need by the time you become a medical officer. Those should be your focus, and not having exorbitant goals, so to say. So have those skills that you will need to function effectively as a medical officer when you finish your house job at the core of your focus, and every other thing can come after that. So like I said, some of these factors will be negotiables for you, some will be non-negotiable, but these are all the things that you want to have in mind when you're deciding where you want to do your internship. I hope you enjoyed this video. If you have questions, do leave them in the comment section for me, and I'll be very, very glad and super excited to answer your questions. If you also have things you want me to discuss about the house job on my channel, that's very fine. I'll be very happy to do that for you. Don't forget, if you're new here, hit the subscribe button, like this video, share this video with your colleagues and everyone you think it will benefit. And of course, you expect to hear from me again. Thank you. My name remains Dr. Gospel, and I'll see you next time.